Welcome to Healthy Body, Healthy Mind. I'm Carlos Pagan. There are over 100 different types of arthritis that generally affect some common areas of the body, our joints. The major difference with rheumatoid arthritis is that it's a systemic disease, often affecting the entire body in most patients.
How long did it take you to limber up from that stiffness in the morning?
If left untreated, rheumatoid arthritis can be devastating, often changing lives within a matter of months.
All types of arthritis will cause some type of problem with pain, swelling, and stiffness of joints. The additional thing in rheumatoid arthritis is that people can feel poorly. They feel ill. They're fatigued. They just do not feel themselves. They have lost their energy. Fortunately, we have better and better treatments for some types of arthritis, most particularly rheumatoid. We know that we can halt joint damage and halt the inflammatory process for the majority of people with rheumatoid, and the earlier we find it and intervene, the better outcome for the patient.
Dr. Alan Kivitz is president of the Altoona Arthritis and Osteoporosis Center in Altoona, Pennsylvania.
The immune system is supposed to be our friend. It is supposed to be protective of anything that affects us from the outside, infections, bacteria, viruses, etc. But sometimes the immune system does not function the way it's supposed to. And when that happens, you can have what is called an autoimmune disease. In essence, our immune system is turning against us and therefore causing diseases that are really a factor of the immune system, instead of fighting outside invaders, fighting against something internal.
This reaction from the immune system causes pain and inflammation. Not only can it affect joints in the body, but it can also spread to other organs, like the heart, lungs, and kidneys in chronic and severe patients. Marjorie Deem's symptoms were rapidly getting worse. She and her husband Gary struggled through the first month. Not knowing fully what lay ahead, they kept a journal.
Well, here's even when you said your knees and your shoulders hurt some.
I was noticing things. I would take a weekly diary, daily diary, and I would mark things down. That when she would pick something up, she couldn't hold on to it. It was like her hands weren't working. And it was almost like, well, we have to do something here.
The most important thing to look at to diagnose rheumatoid arthritis for us as rheumatologists is swollen, inflamed joints. If we have someone who says that their joints are stiff, painful, that makes us concerned, but what we actually have to look for on the examination is inflammation. Then we back that up by doing blood work. While we don't cure rheumatoid arthritis any more than we cure other chronic illnesses like diabetes or high cholesterol or high blood pressure, we control it as we do the other conditions as well. We've always been able to control to some degree people's rheumatoid arthritis with the older medications, but there was always a need for something more. The difference is that with the biologic therapies, people feel a difference very quickly. They start to improve energy right away. They can see improvement of swelling right away. It becomes very dramatic for them. It is true that not everyone responds to even some of the newer biologic therapies, but what the great thing is that right now, besides all of the activities in clinical research that we have for newer therapies, we have many already approved biologic therapies that can be used even if one category of medications is not working. We have 2 other categories, 3 other categories. We almost always can find something for everyone.
Rheumatoid arthritis remains a complex disease, and there is much to be learned about preventing it and curing it. But research yields many insights. Scientists and physicians are making rapid progress in understanding this condition, and their results are having an impact today, enabling many patients to remain active in their family and work lives far longer than was possible just a few years ago. Well, that's it for this edition of Healthy Body, Healthy Mind. I'm Carlos Pagan. See you next time.